The internal brow pexy is a useful adjunct to blepharoplasty for correcting mild brow ptosis, particularly of the lateral 2/3 of the brow. In addition to the usual preoperative blepharoplasty skin markings, a mark is made at the inferior edge of the eyebrow in line with the lateral canthus. The aim of the internal brow pexy procedure is to raise and secure the brow at this point to a position around a centimetre above the superior orbital rim. It is advisable to mark this point as the tissues will become distorted by the local anaesthetic and blepharoplasty surgery. A skin muscle blepharoplasty is done. Other videos on this website explore this procedure in more detail. The septum is incised towards the lateral side, and depending on the needs of the individual patient, fat can be debulked as you see here. Further layers of septum where it merges with the arcus marginalis are incised to access the superior orbital rim. A 4-0 or 5-0 suture is passed from external to internal at the marked point on the skin. A vicryl suture is being used in this video, but a minimally reactive non-absorbable suture such as Prolene could equally be used. Next, the needle is passed to take a healthy bite of brow periosteum at the height at which the brow is to be raised and secured at. Typically, this is around 1 centimetre above the superior orbital rim. This bite must start in line with the skin mark, or the lateral canthus, and can pass either medially or laterally. Next, a healthy bite of the internal aspect of the brow tissue is taken with the needle returning in the direction from which it came and exiting close to the point at which it entered into the brow. The exit point must be on the deep surface and not through the skin. The loose thread that is still on the external surface of the skin is pulled through to the internal side so that the suture will be entirely buried. This clip is shown at slow speed, as burying the suture can initially be confusing. The suture is initially tied on a bow and the brow position assessed. If the suture has been positioned correctly, the brow will have been lifted and will be securely fixated to the chosen point above the superior orbital rim. Also check that it is still possible to close the blepharoplasty incision without great tension. A small amount of tension is fine. If the desired position has been achieved, the bow is undone and the knot is tightly tied with several throws. A further brow fixation suture can be placed more centrally if desired, although a single suture is usually adequate. The brow suture bites can include the deeper dermis, which will help secure the brow, although may produce a little skin dimple when the knot is tightened. The dimple will settle, although this can take a few weeks after surgery. The blepharoplasty skin incision is closed, in this case taking a few skin crease reforming bites.